Chief Synan.
Thank you, Chairman Portman and Ranking Member Carper, along with the subcommittee, for giving me this opportunity to discuss this very important topic of how synthetic drugs such as fentanyl and carfentanil are destroying the lives of loved ones and our communities. In my 24 years of law enforcement, I've never seen a substance cause such damage and devastation with its death rates that have risen higher than levels than car accidents and homicides combined. I've witnessed the power of drugs in my small community, watching an entire family, from the mother to her 3 sons, wiped out. 3 brothers, an entire generation gone because of drugs. The last 2 brothers due to heroin. Events such as this led us to form the Hamilton County Heroin Coalition at a time when we were calling this epidemic with an average of 20 to 25 overdoses and 1 to 2 deaths a week, an epidemic. In July of 2016, I received a call from the Greater Cincinnati Fusion Center, a part of Homeland Security, a center that was originally designed after the 9/11 attacks for law enforcement to share intelligence on potential terror situations, which could analyze and share local and federal law enforcement along with the public. Recognizing the center's ability to analyze data and share it quickly among various agencies, we adapted its use for heroin, tracking overdoses, locations, and intelligence that could track trends on the street. At 10 p.m., that call told me, "Tom, there's a new drug on the street called carfentanil." I asked, "What is carfentanil?" The response was, "We aren't sure. It's used to knock out large animals." I replied, "Like a pig?" And he responded, "No, elephants." We passed this information on to the coroner and Hamilton County Health Commissioner, trying to obtain as much information as we could to try to figure out what the introduction of carfentanil on our streets would mean. What we learned about this drug was frightening. The top of the fentanyl opiate chain, potentially used in some chemical weapons, the drug not intended for humans, so powerful that the equivalent of 2 grains of salt had the potential to kill a human. This drug, 10,000 times more powerful than heroin, was now on our streets, leading us to issue a public warning, so concerned not only for the user, but first responders, hospitals, treatment centers, and the public, all who could unknowingly be exposed to this extremely dangerous synthetic. We were so concerned for the safety of law enforcement, we recommended stop field testing of heroin, which is a process needed to develop probable cause to arrest a person for heroin. The officer's safety is the priority over enforcement. This warning has reached other states such as Georgia and Florida, who have also stopped this practice to ensure the safety of their officers. With all the dangers already facing law enforcement, this danger, which could be undetected until it was too late, was a danger that concerned the most hardened police veteran and led police administrators to modify policies to protect their officers. We knew this drug was strictly controlled and monitored in the U.S., and with the assistance of the DEA, we determined it was not coming from sources within the U.S. We could have never anticipated that our epidemic would reach levels more along the lines of a pandemic and become the new normal. In the week of August 19th through the 27th of 2016, an event occurred that would forever change the heroin epidemic in our area when the hardest hit, Cincinnati, experienced nearly 200 overdoses and 3 deaths in 1 week. Seeing and hearing from dealers and users alike that there was nothing on the streets than synthetic drugs like fentanyl and carfentanil, we experienced the literal shift from the organic opiate of heroin to the synthetic opiate of fentanyl, all its derivatives, and carfentanil. This shift in synthetics is testing the limits of users, first responders, the system of government, hospitals, and the spirit of each person who, no matter drawn in by choice or necessity, is to the point of breaking. I not only witnessed the devastation, but the determination of those same people who day in and day out try to keep up with the new normal, the new average of 50 to 70 overdoses with 4 to 5 deaths a week. Moments of spikes where 70 overdoses occur in 1 weekend, 11 people die in 1 weekend, and multiple overdoses at the same time in the same location. At times, overdoses reach nearly 40 in 1 day, stretching the resources of even large police and fire departments, such as Cincinnati, who in 1 district with 20 officers had 16 on overdoses and 4 on shootings, causing every officer to be unable to respond to other calls. In 2012, our area had 7 deaths that were fentanyl related. In just 3 years, that number exploded to 238 in 2015. Heroic efforts made by many who initiated innovative programs such as quick response teams that tried to connect users to treatment, the coalition issuing Narcan to every first responder who in 19 months has used over 7,500 kits of Narcan. The sheer volume of numbers has led us to follow the mantra of the starfish parable, where a young boy was walking down the beach where thousands of starfish had washed up. The young boy would pick up a starfish, throw it in the sea, and go for the next one. An old man seeing this stopped the boy and said, "Young man, there's too many to make a difference. You can't save them all." The young boy picked up a starfish, throwing it back into the sea, replied, I saved that one. This description we follow is beautiful in its nobility and heartbreaking in its reality, describing where we are right now in this epidemic. But no matter how great our efforts, our initiatives, our determination, the tremendous influx of such powerful synthetics such as fentanyl, which illegal labs have altered the molecular structure of fentanyl into even more powerful derivatives, which our coroner's office has identified at least 10 variations of fentanyl, and the current ultimate on the opiate scale of carfentanil have rendered each initiative less effective, forcing us to change our beliefs in order to keep up with its power. The original 2 milligram Narcan we issued to over 1,000 police officers now obsolete, having to replace with a higher concentration of 4 milligram dose of Narcan, which often, due to the strength of the synthetic, require multiple doses. It is more common to hear of users unconscious taken to the hospital being placed on a constant Narcan drip in order to keep them alive. These synthetics so now ingrained in a user in our area that when we think the situation can't get more difficult, cause even more fear, dealers insensitive to the damage they are causing to the users and our communities have now begun to place these synthetics in other drugs like cocaine. This will not only cause more overdoses, but deaths due to the cocaine user's body not accustomed to not only general opiates, but especially ones as strong as carfentanil. Carfentanil, now so common in our drug supply, a staple in the heroin supply, is now expanding. Just a couple weeks ago, 4 people in Cincinnati who bought what they thought was just cocaine overdosed. 2 died on the scene, 2 left in critical condition on Narcan drips due to that cocaine containing fentanyl and carfentanil. Since I submitted this report last week, another person at the incident died. So 3 have died, 1 still hospitalized at my last check. That same week in my small community, a mother drove her 10-month-old baby into a driveway where she got out and collapsed. Neighbors called 911, brought the baby inside where the officers arrived, and the mother regained consciousness. She, believing she had only purchased heroin, it was found out that she actually had been given a mixture of cocaine, fentanyl, carfentanil. And since I submitted this report last week, myself and 2 officers stood over the body of a 26-year-old at that same location who died from a suspected fentanyl overdose. I commend this committee for taking the time to hear, investigate, and look into ways to help reduce these powerful synthetics from entering our country, drug supply, and our communities. I plead with this panel to do all it can to help us stop this poison from even getting in to the country. Although this will not stop addiction or stop every supply, each intervention that prohibits these synthetics from reaching the streets means first responders can get relief from the overwhelming numbers, which has caused such stressors on them in our system that we have coined the term, working with the Ohio Attorney General's office, called first responder fatigue. Take this deadly ingredient from those who push these drugs on our streets so their potions become less powerful. Take this tool away from them so that our tools we are using can be given a chance to work. Reduction from these powerfully devastating synthetics would mean less people would overdose, the numbers of deaths would be reduced, which for us is never lost, that each one of those numbers is a person who has a mother, father, brother, sister, son, or daughter who will forever grieve the loss of their loved one. Thank you for allowing me to speak on this subject. I commend you for your compassion to want to help all of us in making the lives we serve better. Thank you.